Before I get started, I'd like to address the recent news coming from the United States, where the President and First Lady have tested positive for COVID-19. Sophie and I both wish President Trump and First Lady Melania Trump a safe and speedy recovery.
Prime Minister, I wonder if you could tell us exactly when and how you learned of President Trump's diagnosis and what your first thoughts were, and whether you see, if you have any expectation that there will be a meaningful escalation of that administration's management of the COVID pandemic.
When I woke up this morning, I was apprised by my team that the President and the First Lady had tested positive. Of course, my first thoughts are in support of them, and I hope for a speedy recovery. They had certainly reached out when Sophie got her diagnosis earlier in the spring. But let's not forget that yesterday, thousands of Canadians received a positive diagnosis of COVID-19. People are challenged with this every single day across our country, and our responsibility as a government is to do everything we can to support them and to arrest the spread of COVID-19, and that will continue to be our priority. Obviously, we want to see the virus come under control right around the world, across Canada and around the world. And that's how we've been acting as part of international vaccine initiatives, part of doing our part to get this virus under control in Canada. And we've seen other countries do different things. Obviously, there is an election going on in the United States where stances or approaches on COVID-19 have been a polarized political issue. In Canada, we've been extremely lucky that it has not, that there has been a concerted effort across orders of government, across political parties to work together, to be there for Canadians and to get this virus under control. We're certainly going to continue with that in Canada, and we recommend it as a path for people all around the world.
Prime Minister, in light of news about President Trump, what specific precautions do you take when you're working with your staff? And have these precautions changed at all in the last 2 weeks as cases have risen?
From the very beginning, my staff, my office, and as much as possible, everyone in government have been following public health advice. We have consulted directly with Dr. Hammond Pihak on many instances, including around questions of meetings and potential travel and announcements. We will continue to follow public health advice every step of the way as it evolves and as it is adapted to the situations we're in right now.